Hi, friends. I am Dr. Apoor Mehra, and I welcome all of you to this special talk, heart to heart talk with Professor Dr. Vinay Aggarwal, sir. And as we say, when you talk about soccer, and there are some words that would come to your brain like Ronaldo, Ronaldinho, Messi, you know, and so is in the field of education when you're building up something called as conceptual pediatrics, which is for pediatricians, the budding pediatricians of this country, and I'm very sure they'll create a name in the world. We have very astute clinicians making it, and amongst them is Professor Narayan Mathur sir, Professor Sunil Gombar sir, and we have one of the phenomenal person with me here, Professor Dr. Vinay Aggarwal sir. Sir, welcome to this talk, sir.
Thank you very much, Dr. Mehra. Thanks for inviting me. I'm very pleased to come here and share my thoughts with you.
So in this talk, sir, I take you as a clinician into private sector, and I take you as a teacher. And balancing both the things is a little tough. How are you doing it, sir? Along with the private practice, the interest into academics.
You have to have interest in the academics, otherwise you can't progress. Continuing medical education is an essential part because the medicine is changing very rapidly. So, if you are in a clinical practice and you want to progress, then academics is a must. You have to attend national meetings, international meetings, state level meetings, and even the meetings in the hospital. And then you have to be a part of the academic activities. So it is, you can't separate the clinical duties from the academic duties.
So this is something which has been beautifully coined by our teacher of teachers, Professor Dr. S.M. Tuli sir. When we started off e-conceptual in 2019, he gave a tagline to it, the learning never ends. So this is something that you should keep evolving, and there is never an end to it because as clearly mentioned by Hippocrates, a doctor should study every day. The day he stops studying, that's the last day of his life.
So that's absolutely correct. Absolutely correct.
So your journey so far, so your graduation college?
Yeah, I'm from Maulana Azad Medical College from Delhi.
So once a Maulanian is always a Maulanian.
Maulani, yeah, it is. That's true.
Then subsequently, sir?
Then did post-graduation from Maulana Azad. So my experience, had the wonderful period only in Maulana Azad and Associated Hospital, that is LNJP and GB Pant Hospital. But after just passing out doing the post-graduation from Delhi, I thought, let me just see what is happening in the western part of the world. So at the age of 22, 23, I went to UK. And obviously, I continued practice in pediatrics. And there is a good National Health Services program there. So I really enjoyed there.
All right. So you were in UK for how long, sir?
14 years, I never thought I will be there for 14 years, but the time passes by very quickly. And once you have done the general pediatrics, then I was told by my senior colleagues I should do a subspecialty. And somehow, one of my teacher in Maulana Azad, he was an adult nephrologist. I really always admired him. So I got the opportunity to go into the pediatric nephrology. So I was really glad. And that was the really beginning of my pediatric nephrology career.
So I have a question here, sir. You did general pediatrics for quite a while.
That's correct.
And then you went towards pediatric nephrology.
Yeah.
Right. This is what I would like everybody to understand. First of all, you need to understand your branch well. Because the patient directly will not come to you filtered that this is what it is in the beginning of your career. You will have to filter your own interest over time. You might end up choosing something very quick and you'll realize that's not your area of interest, because I have seen people from India working on hips a lot. But we Indians have very good hips. Our hips don't get damaged. So the number of hip diseases are very few in India. The primary arthritis of hip is almost unknown in this country. So then you realize after 5 years of doing work on hip that majority of the patients are not of hip. You need to work on the knee, and you lose very crucial time period. So your area of interest along with the patient pool, what you wish to do has to align together. So if 14 years you were in UK, then you came back to India. What got you back to your nation?
Oh, I'm a passionate Indian, you know. I don't mind saying myself as nationalistic. So, my children are British citizen, but I'm an Indian citizen. So, I think the question can be put it like, why I stayed there 14 years? I thought I will be back to India in 6, 7 years because I went into pediatric nephrology and then, kidney transplant programs and the dialysis program. So that got kept on prolonging. And I was lucky to reach the top ladder as a consultant in a teaching center. So, that was carried on. But I was pretty sure before my children get over 6, 7 years of age, I should come back to India. Otherwise, they will find very difficult to settle in India.
Fantastic, sir. Sir, we all have people who influence our life. And you're not allowed to take the name of your wife in this talk without any pressure. But can you name few individuals who actually carved your career into what you are today?
I've been very lucky, I should say. Our teachers in Maulana Azad were excellent. And, I cannot forget Dr. S.N. Rizvi. He was the nephrologist in Maulana Azad Medical College. He was so dedicated and hardworking. I really admired the way he used to work, and he was the only nephrologist. So, I never thought at that time I will go in pediatric nephrology. The pediatrics was my passion. And after doing pediatrics in India, when I went to UK for 4, 5 years, over there you have to do general pediatrics and neonatology. Over there say you can't be a good super specialist unless you are a good pediatrician. And I'm really proud, I can say I'm a very good pediatrician. The pediatric nephrology, I consider myself as yes, I'm a super specialist. But, first you have to be we all say we have to be a good human being, good doctor, good pediatrician, and then the pediatric nephrologist. And over there also, one of the good things was they really got best out of me. And they really pushed me to go to the super specialty. Once I have done my post-graduation in UK and did the senior residency and the lecturership over there. So I think the credit goes to the system in United Kingdom as well.
Right. So you named Professor Dr. Rijvi, sir, the organized, structured training in United Kingdom. Any other teacher who had an influence in your life?
Yeah, I think, because I left India when I was very young, 22, 23. Over there were wonderful people, those who were renowned pediatric nephrologists, Dr. Postlethwaite, Dr. Thistlethwaite, Professor Wilson. So, they were remarkable. They were very good human beings and good clinicians. So as along you go ahead in life, you learn. And I would say there was a lady called Dr. Kate Warrior-Jones. Unfortunately, she's no more. She was a wonderful pediatric nephrologist. I learned really a lot. And she was professor in University of Cardiff, where I spent my 4 years of pediatric nephrology. So there have been many people really who influenced the life and my professional career.
Right. Something about your parents, sir.
I think no doubt, everybody's parents are the great influencer. My father was a senior government official. And let me tell you, honestly, I didn't want to go to UK. I was a bit introvert. I thought if I get a job in Maulana Azad Medical College or LNJP, I won't go. I won't go anywhere. But as luck would have it, I didn't get the job. So I was pretty sure I'm not going to work anywhere else, in Delhi, anywhere. So my father pushed me. He said, you are capable. But in those days also, you have to do the PLAB exams, you have to do the English exams. So my father supported me, and that is the history. I went there, I passed all the exams, and I got very good jobs. So, I was very happy to be in the National Health Service system. So I really enjoyed there.
So what I understand here is that the environment of home was positive, was of self-belief, and your dad told you that you can do it.
That's correct. I have to be honest to say, I was not very ambitious, but, to go abroad, as I said, I was introvert. I didn't know how the people, we have got that little bit of, in back of our mind, how the white people are superior and how you will communicate with them. Perhaps, your understanding of subject is not as good as what is in the West. But once I was there, within a matter of 6 months, I was taken as a part of their team, and really I flourished. Credit goes to the system in United Kingdom.
So if you're ready to work hard
Yep.
and ready to face the challenges,
Yep.
take it on.
Yep.
There is no differentiation of caste, creed that can stop you.
Yep.
The fallback is a very important term in the world. If you look at Mahabharat, the fallback of Arjuna was Shri Krishna, and fallback of Duryodhan was Shakuni Mama. So who's your fallback? And who pushes you at the right moment in the career can actually shape your career into a different spectrum altogether. And looking at his career, sir, I was just wondering, 14 साल का वनवास श्री राम को मिला था.
बिल्कुल.
और आपको एक अच्छे पॉजिटिव सेंस में यूके वास मिला.
बिल्कुल मैं सबको कहता हूँ कि मैंने तो एक दिल्ली देखी है और एक यूनाइटेड किंगडम देखा है, और मतलब कहीं काम नहीं किया. 14 साल का वाकई में वनवास था, लेकिन वो बहुत बढ़िया वनवास था. बहुत बढ़िया.
If you look at the dots, as Steve Jobs said, if you look at your career reverse direction, the dots will join together.
Yeah.
The influence of a nephrologist to make him a pediatric nephrologist, the push by the dad to go abroad, rejection or non-selection into a government job in India, it shaped his career into what he is today. For our audience, sir, can you just explain what you're doing nowadays? You are at Max Hospital.
Yeah.
What role do you have there, and how do you spend a day? How does a normal day in Professor Dr. Vinay Aggarwal sir's life looks like?
So I'm an associate director, Department of Pediatric Nephrology at Max Saket. I normally like to finish, do very early ward rounds. So, I'm in Max at around 8:30. I always start with intensive care. They are difficult patients, and overnight I know what are the issues, what is the problem going on. So we spend around 2.5 hours there. And after the round, I always have some question in my mind, which I discuss with my associate consultants. It is a purpose is to, I would say, to stimulate them so that they can pick up something new from me. And we have very good residents, and there are postgraduate fellows in intensive care. So there. So 2.5 hours after spending, then I see the patients in the OPD, and then do a short round in the afternoon in the ICU. And hopefully, some days I get 1 hour of rest. And then I start my evening OPD from 6:30, and I finish by 9:30. So I have a long day. And I'm proud to say, for last 15 years, I even work on Sunday. Sunday evening is my nap day. But Sunday morning, I see patients, there are lots of patients from outside Delhi. So they all are asked to come on Sunday because, the workload in the hospital is less and I don't have much commitment there.
फैंटास्टिक. सो कहते हैं कि दुनिया में लोगों के पास काम बहुत कम है, राइट? द वर्क बहुत कम है. काम हमेशा देखता है कि काबिलियत कहाँ है. यू नो, द गुड थिंग अबाउट वर्क एंड मनी इज इट विल ऑलवेज सिट एट द एरिया वेयर देर इज पावर, कंट्रोल, नॉलेज. क्षमता देखकर ही काम आता है. और अगर आप ब्लेस्ड हैं दैट यू हैव वर्क, अगर आपके पास कार्य है तो आपको उसकी इज्जत करनी चाहिए, आपको उसको थैंक यू बोलना चाहिए. सर इज 65 प्लस young individual. Early rounds, understanding that parents are waiting to hear about the kid in the intensive care unit. He understands that overnight things change. He, in his talk, said you have to become a good human being, then a good doctor, then a good pediatrician, and then specialize into a nephrologist. But as a doctor, the most important thing is you have to be a good human being. That compassion has to be there. Then his aim is to pass on the knowledge to his teammates because he doesn't want to take it with him. It has to percolate down. कहते हैं दुनिया में 2 देवियाँ हैं. एक है लक्ष्मी माँ, उनको जितना बचाएंगे उतना अच्छा है. दूसरी सरस्वती माँ, उनको जितना बांटेंगे उतना बढ़ेगा. Third, he is coming back. He can call it a day, but then he's looking at more patients in the evening. And I see Professor Dr. S.M. Tuli sir practicing at the age of 93, and he's doing his own OPDs and he's doing his own work, and that is the only way to be fit. He says, self-care is not selfishness. सर का कहना है स्वस्थ रहो, सेवा करो. एंड सर हमारे प्रोफेशन में I feel as a patient heals, we heal with a patient. No, sir?
Bilkul. I think, you have to know what makes you happy. So I think every individual should know what makes him happy. And I'm very clear in my mind, I get happiness when I work hard, when I see more patients, and if I helped somebody. So by helping someone and working hard gives me happiness. And God has been very kind to me. I think I got more than what I deserve and certainly more than my needs. So I'm a contented man in that way.
Yeah, sir. So there's a lot of things that resonate from a lot of people whom I have had the chance to be educated from. And I realize there are 3 things which have been common in all of them. All of them are grateful to whatever God has given them. All of them had understood being contented and being at peace with what God has showered on them. And there is compassion in everybody's heart. That creates all the difference. I have some short questions for you, sir.
Sure.
Your favorite academic book?
I would say Nelson, textbook of pediatrics, that still remains the best. I would love it.
Yeah.
And
your favorite non-academic book?
That's perhaps negative part of my life. I've never read novels or anything. But I'm a very politically conscious man. And though I'm not in active politics, but I look into the world politics very carefully. What happens in UK, what happens in US, what happens in India. So I think my non-academic is, I would say, politics, world politics, what happens in geopolitics. So that's what I enjoy.
Your favorite sports?
Cricket.
What you played yourself?
मुझे कोई टीम में चूज ही नहीं करता था.
Right. So your favorite place in the world to visit to?
I would say my clinic. Really, I tell you, I really love my clinic.
So that honestly answers my next question. The favorite place in India also happens to be your clinic.
Yeah. I've traveled enough all over the world.
50% of your life is your career and 50% is life partner.
Yeah.
One line about your life partner, because we cannot close this talk without that.
Well, she's a gynecologist. She herself is a very hard worker, very sincere, passionate worker. So I'm lucky to have her. So, we give space to each other, and we are very happily married, and we have got two happy children, and they have done well in their life. But of course, all these things percolates what is going on at home. So our children have seen us working hard, and they work hard. So, it's a happy home, luckily.
Yeah, so that's how the world changes, sir.
Yeah.
As great Abdul Kalam ji said, if you want positivity to spread, the first thing you can do is get peace at home, then the peace in the neighborhood, that gets the peace in the city, that gets peace in the nation, and that creates peace in the world. And that's how the prosperity starts.
Absolutely true. Absolutely true.
Right. So thank you very much, sir, for this wonderful talk.
Yeah.
It was pleasure having you, sir.
Thank you very much for inviting. I really enjoyed the talk. Thank you.
Sir.